new to the Raisina dialogue, welcome to the world's premier conversation on geopolitics, economics, technology, and society. My name is Amandeep Gill. I am CEO of a new global platform called the International Digital Health and Artificial Intelligence Research Collaborative, or IDARE, for harnessing the digital transformation for universal health coverage. IDARE's mission is the collaborative research and development of digital technologies with a focus on networks, needs, and opportunities in low and middle income countries. One way to visualize IDARE is to think of a distributed CERN for digital health, pooling talent and resources, treating problems that no single country or institution could have the resources or interest for, and producing and maintaining public goods through open science and R&D collaboration. A big lesson of the past year has alert and responsive health systems. Emerging technologies associated with the fourth industrial revolution can play a crucial role in strengthening health infrastructure and improving access to healthcare. Multilateral organizations and platforms such as the G20, G7, and BRICS will have to take a renewed interest in developing and promoting the analog and digital infrastructure needed for healthy populations. We have a distinguished panel today to debate this lesson. Carl Bildt, former Prime Minister of Sweden and a prominent voice on European and global affairs, former Minister and Prime Minister Shri Narendra Modi's Sherpa for G7 and G20, Shri Suresh Prabhu, Deputy Speaker of the People's Representative Council of Indonesia, Azis Syamsuddin, also a former banker and lawyer, Simon Duggan, Deputy Secretary for Economics and Industry and Australia's G20 Sherpa, and Shamika Ravi, Professor of Economics and Non-Resident Senior Fellow at Brookings on Governance Studies. Welcome. I think I got the protocol right there, but ambassadors do make mistakes, and my apologies if I missed any important affiliation. Shamika, please allow me to start with you. You are a health economist, and you've argued that the COVID crisis is as much an economic crisis as it is a health crisis. Do you think this will change the view on public investments into health in forums such as the G7 and G20, which see themselves more as crisis managers on economic growth and financial stability? And we've also witnessed the important role of science and evidence-based policy. Data use and dashboarding had to be local, almost hyper-local. Those who follow you on Twitter know how elegant and simply you presented COVID-19 related data for audiences. Now, how do we reduce the asymmetries on data use, on research and development, and bring the spotlight on talents, networks, and opportunities in the global south? Over to you, Shamika.
Thank you, Amandeep. And thank you to Raisina for this wonderful opportunity. We are in the midst of a global crisis, and it is, of course, a twin crisis, health and economy. In fact, I think the debate is a bit misplaced when we think of lives versus livelihoods, because in reality, the two are very closely correlated. And we are seeing country after country, which is why I think forums such as G20, G7, BRICS, etc., cannot overlook the fact that economies have very much followed the path of the infection. Unlike Europe, India had a very long period of lockdown, and as a result of which we saw the economic overall growth decline for 2 quarters, while most of Europe really opened the lockdown very early on after the initial stages in March. And we saw that the economy did boom because economic activity and mobility of people began to pick up. But very quickly we saw the resurgence in the second wave in almost all countries, much bigger than the first. And we saw economic decline sort of follow the infection. My fear is we are going to see that not just in the OECD countries, we are going to see that everywhere. We are seeing that in Brazil, for sure. In India, we are in the midst of the second wave. Of course, I think we are much better prepared than we were last year around the same time. but no country has the health infrastructure and the resources. And I think particularly when we compare ourselves with the OECD countries, we truly are resource poor. And therefore the role of technology becomes that much more important because we really have to stretch our resources when it comes to healthcare. Now, the role for data, Mandeep, is, I think, a very critical one because unlike, let's say, Germany, or in the early stages, we got a lot of information from Japan. We got a lot of ongoing, in fact, real-time information coming out of the CDC from the US. You know, we got a much better understanding of the virus itself, while the spread and the understanding of how we are dealing with it is a local problem. Isolating the virus, the strain, and developing vaccines, etc., have truly been global collaborations. And I think the dependence on multilateral institutions, and this is where the role for, again, these forums and the UN, the WHO, they are greater than ever before, I think, because it is a shared problem, and I think the solutions will also have to be shared.
Thank you very much, Shamika, and we'll return to this local global dynamic on data and the role of public goods. For now, I'll turn to Simon. Simon, the G20 is the premier forum for international economic cooperation. Can it become the premier forum for health cooperation and building a robust global infrastructure on health? Can we somehow extend this, do whatever it takes to overcome the pandemic pledge and the $5 trillion stimulus to, say, investments in a global pandemic surveillance and response scheme so that we are better prepared to protect economies against future pandemics?
Thank you. Really interesting question, and thank you again for inviting me to participate in the panel. So I think one of the things that the COVID pandemic has demonstrated is, as you described, that health is a global public good, and that health outcomes are inextricably linked right across borders. So we're seeing that, in all cases, it's not just enough to think about how we lift our efforts domestically. We've got to think about how we lift our efforts internationally for all our citizens. So there's as I think Shamika highlighted very well, there's a health dimension to this, but there's also an economic dimension to that as well. And one of the things that we've seen through this crisis, as she highlighted, is the role of digital technologies and data really enabling us to really translate that global public good into solutions through global connectedness. And I think bodies like the G20 have played an incredibly important role in that regard, alongside, of course, other elements of the international health system, like the World Health Organization, the World Health Assembly. So, I think that our collective participation in these forums really allows us to build momentum for reform and strengthen cooperation to try and find some of those practical solutions to address those future health emergencies. So, the Global Health Summit, I think, is incredibly important. And I think, to my mind, so Shamika raised the issue of the vaccination. So critical work for me in this next phase for us is to think very carefully about the WHO's Smart Vaccination Certificate and the work in that regard, which to me will need to define some clear specification and standards for allowing us to travel internationally, retain and restore some of those human-to-human interactions while not exacerbating those health inequalities and divides. So we're very happy and proud to be part of that group that's bringing that together, and also very proud and happy to be part of the group within the G20 that's looking at issues relating to digital health in the context of the Sustainable Development Goals. And there we really see great opportunities for digitalisation again to accelerate implementation of the One Health approach through interoperable data and other initiatives like the Global Digital Health Partnership, which we think that Australia and India can play a leading role in to advance improvements in health systems through those evidence-based digital technologies. So to your question, Amandeep, I think there is just huge effort and already underway through each of these forums and huge opportunities for us to really seize those benefits of cooperation in the health space in fora like the G20. So I think, in short, yes, would be my answer.
Thank you very much, Simon. You mentioned the May Global Health Summit that the Italians, as the current G20 president, would host. So, Mr. Syamsuddin, Indonesia is the next G20 chair after Italy, and it takes over at the end of the year and then hands over to India in 2023. This is, in a sense, a crucial bridging role across the three I's who will be leading the G20 over the next couple of years. What would be your advice to the Indonesian government as a lawmaker in terms of Indonesian priorities for its G20 presidency, keeping in mind the lesson of 2020? And before you answer, I'm reminded of Jakarta's hosting of a meeting in 2007 when the global initiative on sharing avian influenza database was born, a neutral platform later endorsed by the G20, allowed researchers to share data on genetic sequences to build a global picture, really played a game-changing role at the beginning of last year in terms of sharing of the SARS-CoV-2 genome sequence, which allowed diagnostic tests and vaccines to be developed quickly. So can Indonesia play a similar role as it assumes the G20 presidency next year? Over to you, sir.
Thank you very much for the Mr. Suresh, and then hello Mr. Carl, and then Mr. Simon and Tan Kirapi and Amandet to coordinate this dialogue in order to raise the issue, sign dialogue for the hope, harmony, and the humanity. So, refer to our discussion topic today. So, we have to see the situation right now is during the pandemic. Indonesia is part of in order to solve the problem during the kind of the endemic. And certainly, with the uncertain time, the communication and openness cooperation between government and parliament right now in order to make regulation, how to approve and then to encourage each country among the world, especially between the bilateral, in order to provide the vaccine. So refer to our discussion and then your question. This is any encourage the problem of the G20 for the president. So refer to our regulation between parliament and to Indonesia. Our priority in Indonesia is G20. So we focus on vaccine right now. How to fulfill, how to make it all of the people in Indonesia to get vaccine. That's why we create the Nusantara vaccine with the local content. So Indonesia right now, in order to looking the partner strategy in order to diplomacy for the vaccine around the world. But internally, we try to make it Nusantara vaccine in Indonesia. That's our condition right now. So every day, the government and parliament, especially parliament, support for the government in order to vaccine. During the government is looking for the partner strategy in order to diplomacy vaccine, and the other side we make it the local vaccine that we call it Nusantara vaccine. Thank you very much.
Thank you very much, Mr. Syamsuddin. You've highlighted the immediate priority of vaccination, indigenous vaccines, imported vaccines, and then Simon mentioned the importance of the smart vaccine certificates, SVCs, that allow travel to resume, interaction to resume and reinforce the economic rebound. And I'll come back to you, Mr. Syamsuddin, about Indonesia's own experience with fourth industrial revolution technologies, and as the fourth largest population of internet users and a growing nursery for tech unicorns. For now, let me turn to Shri Suresh Prabhu. Sir, you might recall that when you were Commerce and Industry Minister in 2017, we had the privilege of presenting to you the report of the Task Force on Artificial Intelligence for India's Economic Transformation. Do you think that digital technologies, e-commerce, remote working, contact tracing, vaccine logistics made an appreciable difference in India in dampening the economic impact of the pandemic? and managing the burden on the health system? Or would you have wished that India was a little more advanced with the fourth industrial revolution and the digital transformation? And while you have the floor, if you could also address India's experience of digital public goods such as Aadhaar and its new visionary health insurance scheme, the Prime Minister's Jan Arogya Yojana, as India takes the baton from Indonesia in 2023. Over to you, sir. Minister Prabhu, could you please take the floor? If you can.
Yes.
Please
the problem of session is related to technology. This is a problem of technology that if you don't switch on, then you cannot hear. So anyway, so I was congratulating you for doing something so good and bringing such distinguished people on the same screen to talk about what we really need to do together. So while I will address what you asked me to do, but let me just briefly mention, there are 219 countries and territories which are affected by pandemic today. So what does it mean? That we have to definitely look at it as a local issue because 219 countries have to address it in their own territories, in their own geographies, in their own countries. But it is truly a global issue. And therefore, to address it, firstly started with a global problem because it started with some country and then has spread to all parts of the world. 219 is a huge number. So that means that unless we go to the basic, when you use technology also, unless you go to the basic of how do you not allow a local problem to become a global problem. So that is a fundamental issue. If you don't try to do it in future, there will be more pandemics which will be coming and more things will happen. Now to do that, how do you do that? That's the question. And this has been, I've been raising this question with my friends in WHO and others, that what is the surveillance mechanism that we have put in place, that when a local problem happens like this somewhere in different parts of the world, how do you not localize it, keep it at local level, rather than allowing it to go all over the world? And that is the use of technology that you talk about, has to be used. So you can talk about technology for healthcare using artificial intelligence and many others for dispensing different kinds of medicines or healthcare delivery system. That's fine. But that's a problem that comes when the disease is there. And that has to happen even without a pandemic, because that is what you have to do it for normal diseases that people suffer from every now and then, every year in different parts of the country. Like for example, in US, there are every year there is a flu season in which so many, maybe few 100,000 people suffer from it, all every year. And this is a question all parts of the world. In India, there are some other diseases which happen every year. So that is one part that we can deal with technology to deal with that, and I fully agree with you that we must use more and more technology, and in fact India has been using it very aggressively. Prime Minister Modi, in the last 7 years of his prime ministership, has really used technology for spreading it to all parts of the country, villages, and using Aadhaar, as you mentioned, there's a universal identity card, which he is using it for ensuring that each and every citizen first should have an identity, but use the same platform for actually giving so many services to the people. So technology inevitably has to be used. Fourth industrial revolution will make it more and more pervasive, and therefore we have to use it. My point is that why not you first use technology globally to deal with such issues and should not allow the whole world to suffer when a problem like this happens. It's going to happen. This is not the last pandemic, I can tell you. And particularly when we are not dealing with nature as it should be, the nature will always react in some form or the other. The animal-man contact, which is now increasing even more than before, will probably make more such viruses coming from animal into the man, and there could be another vehicle, many different vehicles through which they will travel, but it will happen. So technology should not be just confined to finding out how can you cure people, but you must use technology also to ensure that we do not allow a small little problem to become a global problem. So that is one part. Now, secondly, you talk about G20, G7, BRICS, absolutely right. These are the platforms which are very necessary. But G20 and G7 is only a platform. It's not an institution. We need institutions to address such problems globally. And we have created multilateral institutions. One of the institutions for dealing with healthcare is G20, it's WHO, World Health Organization. Now you must strengthen WHO. You must make it more effective. WHO cannot be just a body in which after some time they'll just keep releasing information, database. That's important. But that's not a job of WHO alone. That's the job of compilation of data where many others can do it, even academic institutions can do it. The job of WHO should be to ensure that we will not allow a problem to affect such large number of people. And then in turn, as you asked the first question, Shamika, affect the economy. In fact, health and economy now related. Health and society is now related. And therefore now we have to realize that everything is related, everything is integrated. So you cannot deal with one little problem in isolation. You must deal with it in holistic manner, and even holistic manner not in terms of dealing with nationally or locally, but even globally. That's a challenge. That's an important issue. And therefore, we have to use it. Now, coming to your point, I must congratulate you for bringing a fantastic report. When I was a Commerce and Industry Minister, I remember having received that excellent document from you. And I can tell you that India must use more of all these emerging technologies, not just artificial intelligence. We have to use our own natural intelligence to use more of technologies and make sure that such technologies will address the many challenges that we are going to face in the future. Of course, the climate change itself is a problem arising out of technology because it happened because of industrial evolution. And industrial evolution is basically a technological idea. But now we have no choice. Technology is the only solution. The right technology, using this ethical part of that technology, bringing it to integration is very important, and we must do it. I must thank my dear two friends who are my colleagues. One is from Australia, whom we work closely, and also from Indonesia, who is now going to host it before us. And when I announced it in the G20 Sherpa meeting, I said Indonesia is such a good friend that we like to follow them rather than preceding them. So we really look forward to doing that, and I'm very happy that our distinguished former Prime Minister is here. And of course, Shamika has been giving a wonderful job in giving information all the time. So I look at it as a challenge for the world community, not just to deal with it locally, because that local challenge has to be dealt by local populations, local people, local governments, anyway, and national government. But what is the global governance on health? That's a very important issue. If we don't address it today, we'll have more problems to come in future. So I think global governance on healthcare is an as important issue rather than dealing with global governance only in relation to dealing with some arms of the United Nations.
Thank you very much, sir. So that's a great segue to Mr. Carl Bildt. Sir, you have the floor. You are the WHO's Special Envoy for Access to COVID Tools Accelerator, a G20 WHO initiative in the current context. Please.
Yeah, thank you. And it's a pleasure and honor to be part of this important discussion. In the middle of us all dealing with the pandemic on a day-to-day basis, that will unfortunately go on for quite a while, we must also discuss the lessons that we have started to learn and what can be done. And I think that touch on two levels. I mean, the first is, which has already been highlighted, clearly the need for reinforced global cooperation. We live in an age of increasing geopolitical tension, as we're all aware. We need to, on certain issues, climate and global health, we need to leave that aside. The politics is one thing. Here it is global, common, global interest that we need to take care of. And I think everyone agrees that we need to reinforce global health cooperation in different ways. There's a report coming in a couple of weeks from Helen Clark, the commission headed by Helen Clark, with some recommendations. There's going to be discussion at the Global Health Summit, as has already been mentioned. There has been discussion whether we need a new global pandemics treaty. There are quite a number of informal arrangements. I'm sort of, as you indicated, I'm for the WHO responsible for working with the ACT Accelerator, which is meant to accelerate the availability of all of the COVID tools that are necessary, vaccines and therapeutics and testing from all of the different providers of those particular things. Here we clearly need to do very much more, not only today. We need $22 billion, by the way, more if you have any money. available, that would be happy to receive that. But also dealing with the acute problem, with the long-term conclusion. Then I think what we've learned, among the very many things we've learned, is really how useful the digital technologies can be. I'm leaving aside the enormous success it has been to get as many vaccines out there as fast as it's been done. And the fact that we are now increasing vaccine production by a factor of 3 and 4, and even contemplated the possibility of vaccinating in a fairly short period of time most of the population of the world. Nothing of this has ever been envisaged before. But on a more local level, we've seen now talking Sweden, I've seen in other countries, the US, how digital health, people being in contact with their local practitioner, with their local hospital, on all sorts of issues related to COVID or related to other things, how that has been absolutely booming. There are some issues associated with that, how you finance it and your reimbursed costs and whatever. So there are issues to be sorted out. But there is no question that we are in the beginning of a revolution in digital health. Add to that what is sometimes referred to as the Internet of Bodies, that the different devices that we all have, all over the world more or less, they give information on the state of different parts of our bodies in a way that can be extremely useful for preventing diseases and treating diseases and dealing with it in completely different ways that are far more efficient and also far more cost effective than we've been doing before. So I'm quite certain that there will be an intense discussion in the different countries, but also I hope a reinforced global discussion on all of the things that we can do in terms of digital health, in terms of the Internet of Bodies, at the same time as we get the discussion how to reform, beef up the WHO and other global bodies, because the architecture of global health is quite a diverse and distributed one, and I think there are advantages associated with that. Not everything is dealt with necessarily best only by a UN body. It needs to be a coalition that is fairly broad-based, with private-public partnership of different sorts. Manufacturing capability for vaccines, obviously an example of that, research, another obviously example of that. So I think we're heading for a situation where global health will be one of the most important factors for politicians all over the world to focus on, not only dealing with the pandemic as we have it, but dealing with the challenges that we need to face in the years to come.
Thank you very much. I know that you have to leave us shortly, but I just wanted to say that not many people know that you've been a digital pioneer. You were involved in the first ever email exchange between two heads of government, you and President Clinton, back in 1990.
A long time ago. Don't mention it. It was a long time ago. It was Bronze Age. Thanks.
Thank you so much for spending some time with us today. And you really, like Minister Prabhu before you kind of mentioned the heart of the matter, which is the pandemic surveillance and response, the international framework to manage alerts and warnings, and also the need to strengthen the WHO. And the report of the panel is due next month. The Secretariat is being led by a distinguished Swedish expert on global health, and look forward to that report contributing to a more creative and timely response in the future. So, thank you once again.
Thank you.
I wanted to now return to you, Shamika, and talk a little bit about digital public goods. So railroads, ports, and schools, the public goods of yore that we still need so that no one is left behind. But today we also need digital platforms for payments and loans, digital IDs that respect human rights and citizen agency, standards and benchmarks that level the playing field for entrepreneurs, big and small. But the reality is that the digital divide still persists, and it combines with old exclusions to create new challenges. So how do we, through the creation of public goods, enforce inclusiveness and avoid new digital divides? How do we ensure that a large part of the world is not just consuming digital goods and services produced by a small and narrow elite elsewhere? So in a sense, how do we ensure that R&D and science asymmetries are reduced and the emerging geographies of innovation in the global south can make their own contribution to solving the world's problems?
So Amandeep, I think India has already shown, I think through experimentation, both in the public space as well as through the markets. If you just look at the amount and the nature of experimentation that we have seen emerging in the startup space, and a lot of them really targeting what are in the realm of social impact, because they are helping improve access, affordability, and quality, frankly, of healthcare, education. And I think that is why it's very important to think of healthcare also as an infrastructure. Public health, increasingly now we are beginning to see, country after country, that public health really is at the heart. It's a cornerstone of almost all economies. Countries that are fragile, that have fragile public health systems, are facing a much more difficult problem. And I think the nature of it, I think the fundamental economic sort of phenomenon there is the fact that there are very serious externalities. So when you think of communicable diseases, unlike the lifestyle diseases that we usually talk about, increasingly now, the non-communicable diseases like heart ailments, diabetes, etc., when it comes to infectious diseases, as is the quality of the current pandemic and past pandemics over the last 100 years, but increasingly the risks that much more magnified because it's a highly interconnected world, as Mr. Suresh Prabhu just very well elucidated. I think technology has to be used to minimize potential risks as well. So while we are seeing great experimentation within the markets in terms of improving access, we are seeing a country like India, frankly, leapfrog through using technology, and a lot of it, frankly, on the back of Aadhaar, improving access to care. And now the vaccination drive is in a very basic way connected to our digital health infrastructure. But we also have the health stack, something we don't talk about enough, and newer innovations. The way the health stack in India is improving almost every week. So the potential is very large wherever you have externalities. But on the global front, I think, as the Prime Minister, former Prime Minister just mentioned, I think there is a very big role, because we have to now begin to think of ways in which we can think of global health governance in ways we can minimize the potential for future outbursts. And as again Minister Prabhu said, this is not the last pandemic that we are going to be facing. We have to be prepared for many more. But I think the micro revolutions we are seeing across India, they do give us an insight into what are the possible benchmarks, what are the possible blueprints for the future innovations.
So in a sense, the globe needs to catch up with some of these local and national innovations on public goods. And Simon, you had touched on some themes around data interoperability, around One Health, which I think Minister Prabhu kind of put into this holistic framework. So let's just pursue that a little bit. Now, in Australia, through Digital Health Australia, you've taken steps. It's a pioneering approach to earn citizens' trust and building up public support for the value added by digitally enabled health services. But as Minister Prabhu said, there is this world of possibility beyond digitally enabled services, and which is the real-time integration of data from diverse sources across One Health, human health, animal health, the shifting environment. We've had the bushfires, we've had all these pressures on our living space. So how do we bring together data in real time And how do we enable the quality of the response at various levels, from the local to the national to the global, without waiting for political decision thresholds to be reached? We saw that with the COVID-19 pandemic. And yes, there is a debate about the pandemic treaty and strengthening the international health regulations. But is there a way in which nations can come together from a platform approach to a more institutionalized approach to bring diverse streams of data together and generate better alerts for the future?
Yeah, thank you, Amanda. Really big question. I think that the answer to the question really is that, clearly, in some ways, the pandemic has forced us to accelerate a digital transformation in health that for many countries, India included, but certainly Australia, had been underway for some period of time. So in our case, we had for some time a record of each Australian citizen's health records were kept in an online way. And what that allowed us to do was the seamless transition of data on an individual patient was being able to be provided across our healthcare system, which meant that if you were travelling, for example, in a regional area, then your regional doctor would be able to access that data immediately. And so their capacity to look at your health history and assist in the diagnosis, understand where your healthcare is up to, leverage off that data, and then provide the right diagnosis for you, massively improve the quality of care. But at the same time as well, that digital transformation for us has also made huge gains in terms of equity of care. So like India, we're a very large geography. We have a lot of rural and remote areas. Those areas, of course, in many of them don't benefit from being closely located with major health centres. And so we rely very much on the capacity of our digital services to be able to support those communities. So to give you one example, we have a health service called Spinifex, which is an Aboriginal community-controlled health centre that used to, pre-COVID, would fly 1,500 kilometres to go and visit an individual remote community in Australia. With some of the travel restrictions and the social distancing restrictions caused by COVID, that was no longer possible. So what they are now doing is they've set up a virtual clinic in remote communities, many remote communities, which they're now servicing from within one of our capital cities. And what they're able to do is use the best physicians in Australia to help to diagnose, provide a healthcare plan to those people in those remote communities. And then as part of that diagnosis, in some extreme cases, of course, they recognise that someone will require a medical evacuation, organise that medical evacuation and get them to where they need to go. Now, that was forced on us by COVID, but the results that we're seeing from that are so strong that approach will endure. So we'll have a dual system of face-to-face healthcare along with that digital health approach. But key to all of that and the interoperability really is clear standards and trust of citizens in the privacy and the security of the data. So achieving that domestically is a challenge. Achieving that internationally is even more challenging, of course, when we think about interoperability across all our health systems to achieve that trust. But the gains from it are enormous. And so we think it's something very much worth pursuing. And so in our engagement on digital health issues, free flow of data with trust, which Suresh will be very familiar with from Japan's G20 host year, all of these initiatives we think are incredibly important for unlocking, really what we think is just transformational change in the way we deliver healthcare, which we think promotes efficiency and equity in healthcare in ways that I think, certainly in the last 12 months in Australia, I'd have to say that our provision of digital health has accelerated at least 5 years, maybe a decade. As I said, partly because we've had to, but also because we've learned some really great lessons that will endure beyond COVID.
Thank you so much. So standards, trust, security, privacy, and working creatively internationally to reinforce interoperability. Mr. Syamsuddin, I wanted to come back to you and talk about Indonesia as a growing market for the digital economy, a nursery for unicorns, Tokopedia, Traveloka, Gojek, OVO, the list is growing. And like India, there are these challenges, number of beds per thousand population, number of doctors per thousand population. So there are these rural-urban divides. And how do you see the potential for the digital transformation of health systems? And can public-private partnerships, such as the recent agreement between HelloDoc and Indonesia's Healthcare and Social Security Agency, which operates the world's most extensive single-payer system for 220 million plus users, can play a role. Just like in India, the Prime Minister's insurance scheme is beginning to build a basal architecture for digital health, as Shamika pointed out. Could something like this pave the way for the digital transformation of health systems in Indonesia?
Yeah, thank you very much, Mr. Amandat. Basically, the Indonesia we have the commitment in order to get diplomacy vaccine between among the country. As our position is in COVAX and AMC. So we invite, especially for the India, in order to increase the vaccine in order to solve our pandemic right now. And then during our G20, Indonesia right now is starting in order to supply the vaccine with the internally. And basically the Indonesia commit, as you said, Amanda, the Traveloka and then Gojek, we are commit in order to share the data, to share open how many percentage the people is already get the COVID, and then how to process in order to recovery, and then the number of the patient is already helped. So Indonesia commit to open with the transparency by the data, and we expose to the people, and then we expose in TV and media. So basically, Indonesia, we invite all of the countries, especially for the G20 and in specific for the India, in order to get relation with the activity in order to change the data and then the vaccine. And in the last time of my opinion, in our communication, in our openness, and our together between nations, this is one of the keys in order to stop the problem during the pandemic, in our pandemic. So starting, we preparing mitigation measure and management crisis of the communication strategy in order to including cooperation and openness in vaccine development. So we agree in order that kind of the issue, we need to start to organize for the more addictive international law and what you call it, the institution for the future, and the national should be and then we have to together as a teamwork work together to the nation should feel that the highest position in the past. So I am agree for the statement from the Duggan, statement from the Sanika Rafi and then the Suresh, that we have to make it a teamwork in order to solve the problem and then work together in order to get how to solve the problem, and then transfer data and then openness and communication, co-working together in order that's this kind of the key in order we solve the problem during around the world, especially G20. Thank you very much.
Great. So I think the panel is moving towards some key consensus points. Teamwork, as you mentioned, collaboration, moving from platforms to institutions, data interoperability. But what about money? So finance, the financing of these key national and global public goods. So, sir, Mr. Suresh Prabhu, I want to turn to you now, and I was reminded of the International Solar Alliance, which Prime Minister Shri Narendra Modi launched with his Wembley Stadium speech. So the goodwill is there, the intergovernmental agreement is there, the first global public good in the form of a global solar atlas is there as well. And now a $350 million solar development fund has been created. So could India take the lead once Indonesia hands over the baton of the G20 presidency to India? Could India take the lead in 2023 to launch an ambitious but realistic replenishment, say $1.5 billion replenishment over 2023-2025 for investments into digital health challenges, interoperable digital architectures, the kind of global pandemic surveillance and response scheme that you mentioned, and human capacity, the training of human resources, particularly in the global south. So please, sir, over to you.
See, thank you. I would like to remind you that Prime Minister Modi, when he was invited at Biarritz for the last G7 summit which happened in person in France, and he was the lead speaker on this digital economy, and he made this very important strong point that digital space should be used as global public good, so that more and more people can be brought into the ambit of digital world, and therefore the digital divide will not only get breached, but people will be use digital technologies for their day-to-day life in a much better manner. So this is definitely our strong view, which was articulated by the Prime Minister, and will be taking it forward in all platforms, including G20, when India will host it also in 2023. But the interesting point is that what you're asking is money. See, the money is definitely needed. Money is needed because we have to address a problem. But are we also willing to change our own lifestyles to ensure that first and foremost that the problem for which we are needing money, the problem will not arise to begin with. And that's why the global lifestyle change in the world is very necessary. That is necessary for climate change, that is necessary for healthcare issues, and in India we strongly believe that preventive care is far better than curative care. And therefore I think we really need to work together on ensuring that we bring out new global standards wherein people will not be exposed to the risk of dealing with such health challenges or any other challenges. Now, money is definitely needed. Money is needed for climate change, money is needed for healthcare, money is needed for many, many things. And of course, if you find money, then there is no problem. We can, if the money is like flowing in the river, then there is no problem. But I have always seen with my personal experience, because I have been leading India's delegation for climate change from 1998, when I was the Minister of Environment 23 years ago. And therefore, I have been seeing that money is promised but never comes on the table. And therefore, what we really need to do is to ensure that we try to change our own ways wherein such type of emergency don't arise in future. It is possible, it is doable. We need a global consensus. We need to accept certain facts, and we have to do some do's and some don'ts. If we do that, I am sure we'll be able to address it. But while we deal with all this, while we can do all this and we'll take some preventive measures, but still there is a problem on hand which we have to deal with, and therefore we have to find money for it for sure. One area is to deal with vaccination, and I think vaccination is now happening, more and more vaccines coming to the fore. But let me tell you, experts are saying that once you get vaccinated, you don't get lifetime immunity. This is a temporary immunity. So therefore, we have to deal now with a issue that we may postpone a problem but not solve the problem. Because if we are getting immunity for 8, 9, 10 months, then what happens after 9, 10 months? How do you deal with that? And therefore, I think first and foremost, we must find out immunity which will be permanent. And can we do that? I think that research and development must focus on that, because we have certain other immunization program which actually gives lifelong immunity or for certain diseases. We have to work on that. Again, as we have seen in this particular virus, it gets mutated. It changes the shape, changes the form. It always will happen. Any living being to survive, and that's the basic instinct of every living being, will try to change its shape so that it can escape the imminent danger which is coming in the form of a vaccine. So I think, how do you deal with that? if keep changing all the time, if they mutates all the time, how do you deal with that? So I think research and development, that money that you're talking about, must be invested to focus on issues of this kind. That while preventive but also curative, in that, how do you ensure that research and development of future will work on that? And then you're asking my friend from Indonesia about private-public partnership. See, one thing is very clear, that public health has to be addressed imminently. We cannot postpone it anymore because we did it for decades and we are suffering from it. But mind you, dealing with public health doesn't mean only public money has to be used for dealing with public health. Public health can be dealt with by private money. So private-public partnership for addressing public health is what is necessary. So sometimes we may get confused by saying that public health means only public has to deal with it. It is possible that we can deal with public health by coming out with innovative ideas so that private and public sector can join hands and deal with it. In fact, now we are seeing who is developing vaccines in the world. Most of it is getting developed by the private sector. So we are dispensing it through public sector, but most of it is developed by the private sector. So top private companies are doing that. So that means that we cannot wish away the private sector. We have to involve them into this process and involve them for what? For doing a larger public good, that's improving public health. We should be clearly defining this, come out with new ideas, new policies, which will be transparent, which will be incentivized so that everybody will be able to join into this.
Thank you very much, sir. So investments into R&D, human behavioral change, and incentivizing private sector participation. Thank you for those inspiring thoughts. And I'll now go back to all of us in the remaining few minutes of the panel for your concluding statements. Please feel free to share your final thoughts or any reactions that you might have to what others have said. I'll just recall the overall themes for this panel, which are what can governments do singly and in partnership to catalyze a digital transformation in global health without worsening the existing digital divide? In what ways can current and emerging multilateral platforms and institutions be utilized to enhance knowledge sharing and technology partnerships to tackle future health emergencies? So over to you for your final remarks. Shamika, quick minute for your final thoughts.
Sure. Thank you. I'm going to use my last 60 seconds to raise a phrase which we haven't yet mentioned. And yet we seem to be living in the midst of it, which is vaccine nationalism. And I think given that these fractures in terms of, it's not just governments, it's also big pharmaceutical companies, it's market share, it's future demand. I think we are back to the problem of, the political economy of haves and have-nots, the North and South, problems that we have been dealing with for now many, many decades. So in that sense, we are back to dealing with the same issues of global governance, which we have. And yet, I think this particular pandemic, through global cooperation across countries, across public and private partnerships, have revealed what is possible. And I think India, again, we have, we are a very large manufacturer of vaccines. In fact, just today, about an hour back, Sputnik has been given emergency clearance, knowing well that, we are also one of the larger producers of Sputnik. So I think countries have to leverage their comparative advantages also for a global good. So while we are a very large manufacturing country, we still have to deal with the kind of jostling I think we are seeing between big pharmaceutical companies with support, tacit or explicit in some cases, from their countries. And I think these kind of forums, G20, G7, do reveal what is possible in terms of overcoming this tradition.
Thank you, Shamika. Thank you very much. Simon, your final thoughts, please.
Thank you, Amandeep. I just want to thank the rest of my panelists for some really great insights into the challenges and opportunities surrounding digital health in particular. I think it's abundantly clear, and I think this discussion's really just drawn it out further, that digital technologies and the innovations that they drive in the health sector absolutely integral to our recovery, not only from COVID-19, but as we work together in future to confront future health challenges. I mean, my view is that we'll need to continue to leverage those digital technologies, and it relates, and we've touched on each of these themes, it relates to the effectiveness, it relates to the efficiency, and also the equity of care. I mean, the example that I raised before around digital health solutions, providing doctors with the ability to treat more patients, reducing cost pressures, providing the basis for quality medical advice to reach more people. I mean, to me, that's just an absolute essential going forward. And one of the things I did in preparing for this was actually to have a look at India's National Digital Health Mission, and a couple of things there that I'll take into the discussion in Australia, which I think are really important. One is the target that it puts around a national digital health ecosystem, and also speaking to the importance of these technologies improving lives, but also the acknowledgement, and I think panellists have come to this issue a few times here. I mean, these aren't just the remit of domestic policy, they're the remit of global policy as well. And those issues of global public good and the importance of multilateral cooperation through the G7, through the G20, the WHO and other fora, I think are absolutely critical to our success. So thank you again for the invitation, and Mandeep, outstanding chairing, and to each of my fellow panellists for their great insights. So thank you.
Thank you, Simon. And let me turn now to Mr. Syamsuddin. Your final thoughts, sir.
For the last our discussion for the closing statement, maybe I want to need some note in order to for us our discussion during the Renaissance our discussion. So I am agree to organize and then more of the more adaptive international law and then institution for the future. So we highest position. We should make it on the side the highest position in the past, and then the all happening is the stakeholders sitting together in order to spirit of the multilateralism that it just equal for the all among the us that they by always holding human dignity, and then without the differences. And then the last note, for I want to make it in this dialogue, I'm welcome to the Raisina dialogue, and I'm sincere hope this forum can encourage for the global understanding between us and then of the situation that we are facing today. And the quality of the brotherhood, that in order the cooperation within the framework of the multilateralism is one of the key in order to solve the problem, get out from the phase today that we are make it in order to solve the problem among the us and around the global world. Thank you.
Thank you, sir. Human dignity, global solidarity, excellent closing thoughts. Let me now go to Minister Suresh Prabhu. Sir, please give us a send-off with your final closing words.
You know, this has been a rude reminder to the global community about a reality that we always ignored and we have glossed over. 2008 was another reminder when we realized that this economic model that we talked about, we thought economy will grow indefinitely, was actually challenged in 2008. I don't know whether we learned the right lessons or not, but at the G20 has been working on that particular issue since then. 2019-20, particularly 2020, is another urgent reminder about the way we are heading for a disaster. Because we were thinking that's the normal. We can live like this, we can ignore everything else. But that was another reminder to us. So I think these two reminders, like the body always gives you, body tells you when the disease happens, we ignore it. And therefore that when we ignore it, it also sends us another signal by saying temperature. It is like the dashboard on your car, which keeps flipping and then telling you this is something is wrong, something is missing, try to work it, but we ignore it. So body keeps giving you signal. The same way the nature is giving us signal repeatedly, saying that something is wrong the way we are doing. because we are using resources more than what we have. We are trying to expand economies which has no really a logical reason. We have been using a healthcare system which had already become completely outdated, antiquated, and irrelevant to the present time, but we ignored it. So I think having ignored it for too long, it's a last chance. So what you're asking me for the last word, I think it's the last chance for the humanity to use again our old traditional wisdom, old traditional knowledge. So I'm very happy that Amandeep, you're working on new technologies. But who developed the artificial intelligence? Some human intelligence, right? So that human intelligence also has human wisdom. I think use both at the same time, wisdom and intelligence, and try to use this reminder which is given to you repeatedly by the nature, or else we are heading for a disaster which nobody can save us. So I think it's the last reminder given to us, like the last call before we board, otherwise the plane will take off. I think it's the last call, and now there are no more planes taking off, unfortunately. So at least we can focus on this particular reminder and make sure that is the last call for us, for the humanity. Let's work together, and I'm very sure there is a positivity, while with all this challenging situation, that people have come together. We are working together. We are helping each other. We are holding each other's hands. So that shows that there is a possibility that we can work together. But as it happens in human nature, when the problem disappears, we want to forget about it. Let's not do that this time. Let's focus on it till we solve it. Let's keep the eye on the ball till we play it finally. I think really we should do that. I am sure we'll work on this, and we are all geared up to face this challenge together unitedly and get over this problem to save the humanity from imminent challenge that we are facing. Thank you very much.
Thank you very much, sir. So first strike, second strike, and third strike, you're out. So it is humanity's chance to redeem itself through its innate wisdom, buddhi, as we call it in India, not just what is inside the mind. Thank you to the great panelists for this discussion. Thank you to ORF for bringing us all together. And I'm sure our colleagues at the ORF, Samir and his great team, will turn all that's been said today by the panelists into a thoughtful policy brief. Thank you. I wish you good health and all the best with your very, very important responsibilities.
And thank you, and Dr. Aziz, happy Ramadan.
Thank you, sir. Thank you.
Thank you.
Thank you.